Hello, I'm Jane Williams. Welcome to Webinar 3. This webinar will cover staff roles and responsibilities. Country SAPHN acknowledges the traditional custodians of the lands we live and work on and pay respects to the elders, past, present and emerging. We recognise and respect the unique cultural and spiritual relationships to the land, waters and seas, which continue to be important to Aboriginal and Torres Strait Islander people today. The objectives covered in this webinar include induction processes and supporting documentation, administration and reception, clinical staff, GPs, registrars, allied health, Aboriginal health workers, work, health and safety. Induction processes and supporting documentation. Induction process. A smooth employee induction is essential to set up new employees for success. All new staff must familiarise themselves with the processes and the systems of the practice. All persons employed by the practice must follow the induction process. Accreditation information. Accreditation information should also be included in the induction process, as it is important for staff to be aware of the reasons why many things are done the way they are and why they are so important. Demystify the program. Induction documentation. The induction documentation must be thorough and clearly written and cover every area of the practice. Make it a user-friendly document which can be used by reception, clinical staff, registrars, medical students and GPs. The induction documents must include an induction checklist and include HR policies as well as WH&S. Immunisation status. Remember to ask all employees, and this includes GPs, for their immunisation status prior to employment. Reception and administration. Reception staff expertise. Reception staff have areas of expertise in greeting patients, answering and screening the phones, handling practice inquiries, sorting and distributing mail, and organisational skills second to none. Multitasking and technical prowess are attributes. The role of a receptionist. The role of the receptionist is vital to the practice as they are the front line. They represent all that the practice stands for. They are friendly and welcoming in spite of the treatment they often receive from patients. They always answer the telephone with a smile, and believe me, you can feel a smile over the phone. Clinical staff. Who is a clinical staff member? A clinical staff member is a person who works under the supervision of a GP or other qualified health professional. Clinical staff assist the GPs in attending to patient needs and can include immunisations, care plans, wound dressings, ECGs, spirometry and the taking of blood. Clinical staff registration. Clinical staff must be registered and provide yearly registration, and to achieve this must be involved in education and training relevant to their skills level. Practice nurses. Practice nurses are still relatively new to general practice. 15 years or so ago, GPs weren't sure if a nurse was needed. Now they cannot do without them, and practices generally employ several nurses, all who have various roles. GPs and registrars. GP registrar and supervision. GPs and GP registrars are responsible for seeing the patients in the practice. GP registrars need to be supervised by a GP or a trainer. There are different levels of GP registrars, and the supervision necessarily relates to the level. Level 1 GPT1 requiring the most, and level GPT4 very minimum. GPs and GP registrars new to the practice must go through the induction as with any other new staff member. GP registration and medical indemnity. GP registration is renewed yearly, as is medical indemnity. These two certificates, plus CPD points, immunisation record and CPR certificate, must be available at the accreditation. Other healthcare providers, Staff roles and responsibilities. Who are other healthcare providers in a general practice? Other staff, often employed by the practice, can include allied health consultants, and in the case of Aboriginal medical services, Aboriginal health workers. Regular meetings and discussions. All staff are encouraged to discuss administrative issues with principals or owners of the practice. This could be an agenda item for practice meetings. Meetings are essential and are to be encouraged regularly. Minutes of staff meetings, clinical meetings and GP meetings need to be cited on the day of accreditation. Work health and safety role. There should be one person on staff who is encouraged to take on the role of work health and safety officer, who is responsible for the policies being up to date and changes noted. These policies must be made known during the induction process. Thank you for taking the time to join this webinar today. Country SAPHN gratefully acknowledges the financial and other support from the Australian Government Department of Health. For resources, you can email us at support@countrysapHN.com.au. Resources can also be found online at agpal.com.au and the 5th edition standards from the RACGP.